New research suggests that taking vitamin D supplements could help prevent dementia. This is a number of dementia cases in the U.S. is on pace to double by the year 2060. Joining us now is Dr. Jessica Langbaum, co-director of the Alzheimer's Prevention Initiative at the Banner Alzheimer's Institute. Good to have you here. Thanks for joining us.
Thanks for having me.
I want to talk about this business of, so many dementia patients on the horizon here. Before we get there, though, what do you make of this idea about this study saying more vitamin D, and even by way of supplements, could keep dementia at bay?
Yeah, that's a great question. So there have been a number of studies looking at the role of vitamins and their protective factors in risk of dementia. This one study did find a relationship between vitamin D supplements and perhaps a lower risk of dementia. I just want to caution, though, this is just one study in a large body of research, and it hasn't really been replicated in other studies. And so perhaps that vitamin D supplement is really a proxy for other healthcare and wellness factors that are keeping dementia at bay in these individuals, and it's not the vitamin D supplement itself.
Yeah, because the study suggested it helps clear the amyloids in the brain and helps slow the buildups of those tau tangles and all this kind of business. You're saying pump the brakes a little bit on this?
Pump the brakes a little bit. You know, supplements, they're a big business in the United States, and unless you have a deficiency, we're not recommending that people go out and take those supplements. But perhaps you're getting that vitamin D because you're more active. And you know, the vitamin D levels are a proxy level for having better health, being out in the sunlight, getting things of that nature that are really perhaps the more protective factors than the actual supplements.
Yeah, I was going to say, we live in Arizona. If you don't get enough sun here, then you're not getting outside. It's kind of the situation. All right, let's get to this study now. And what's going on as far as figuring out how many folks are going to have dementia in the future, and what is being done about that?
Yeah, it's a great question because people are living longer, right? And so we're living longer lives, and age is the biggest risk factor we have for developing dementia. As we live longer, our risk goes up. And so the study that you're talking about was a massive, long study, 15,000 individuals that were followed for over 20 years, starting at age 55. And what they found is that, as we age, our risk of Alzheimer's or dementia, all causes of dementia, increases. So that between the ages of 85 and 95, it's about 40 to 50%.
Wow.
Right? And so I think, but there's also hope. So I think, in my line of research, what we're looking at are ways to delay or prevent the onset of Alzheimer's disease. We're finding better ways to detect it earlier and now to treat it.
Yeah, I want to get to some of those ways in a second, but you say age is the risk factor. The older you get, the more likely. Why? What's going on there? What is the brain just saying, I've had enough?
So we're looking at, lots of different factors at play. So age is one risk factor, but there are genes that increase our risk. What this study did also find is that individuals, women were at higher risk compared to men. Again, women live longer than men. Black participants in this study were also at higher risk at all age ranges compared to white participants. And so there are lots of factors at play. It's healthcare, our brain's ability to remove some of the bad proteins as we age, and other healthcare factors.
So basically, because aging is an issue in a lot of things in terms of physical health and such, but with the brain, you don't really know what's going on up there, and you're trying to figure out why is that? Is it, again, too much heavy lifting over time? What's...
Right. So, dementia's, there are lots of different causes of dementia.
Yes.
Alzheimer's just happens to be the most common form of dementia. And, so our brain's ability, some of the proteins are building up in the brain, and we have an inability to clear them. But with new research, we're identifying ways to detect it earlier and also to treat it.
Okay, let's talk about some of the preventive measures you were talking about here. What does research suggest? Get rid of vitamin D here for just a second. But what is research suggesting maybe an avenue to take?
Yeah, so there's lifestyle factors that we should all be thinking about. So what we say, what's heart healthy is brain healthy. Aerobic exercise, a balanced, nutritional diet, things of that nature. But also there are new medications that are already out there for people with a diagnosis of mild cognitive impairment or dementia. And then we're trying those same treatments in others in people who don't yet have dementia, but who are at risk for developing it, to see if we can even prevent the onset of those memory and thinking problems, or even some of the bad proteins from building up in the brain in the first place.
Some of the medication can maybe stretch things out a little bit, make it a softer landing, that kind of a thing?
These medications right now remove the amyloid plaques from the brain, and with that comes delayed, people's memory and thinking ability improves.
I seem to recall, and I could get this wrong here, that vaccinations, people who get vaccinations maybe over time, something along those lines, helped in this process. Does that ring a bell?
Yeah, there are some studies about just general, so the vaccinations that we should all be getting on a regular basis, our flu vaccines, things of that nature, are protective against, again, dementia. So are we taking better care of ourselves? So not sure whether it's the vaccination themselves or that these are markers of somebody who has access to health care, perhaps higher SES and things of that nature, and are better able to take care of themselves, because there are risk factors like high blood pressure, hypertension, things of that nature that really are the things that increase our risk.
Last question here. We see, like, keep your brain healthy, do a puzzle, do this, that, get your mind working. Does that make a difference? Because when those things are building up in your brain, I mean, it's nice to be able to do the puzzle and think you're doing something, but do they make a difference?
That's a great question. So there is no, one, is an easy answer, right? You can't. So keeping your mind challenged, keeping yourself challenged and socially engaged, active, those are all important, but not one of those things, is a cure or a whole preventative treatment.
Not necessarily a use it or lose it kind of a situation.
Correct. But, lifelong learning is helpful, and lifelong engagement.
Yes. All right. Dr. Jessica Langbaum, again, Banner Alzheimer's Institute. Good information. Good to have you here.
Thank you very much.